had the great fortune of having the opportunity to do a special innovation project here in Washington State with a number of hospitals. And what's really exciting about the project is that it grew out of our experience with a pilot project in 2012. And we came up with a concept of a hand hygiene huddle. This is a short conversation, nurse-led conversation at the bedside with patients and families at some point early on in hospitalization. And it touches on three things, or this is what our pilot floor designed and had success with. It touches on three things. Why hand hygiene is important, particularly in the hospital setting, how to do it, so kind of a hands-on learning demonstration. Here's gel, you can do it this way, you can wash your hands, soap and water. And then also what to expect while you're here, sort of a normative setting. What are the expectations here? How do we do it here? And how are you going to do it here, and your family and your visitors while you're here? They went to their patient and family advisory council and said, what are your ideas? We're kicking around how to better engage patients and families in hand hygiene during hospitalization. We're thinking this. We've heard about this huddle idea. What do you think? And it was from those two groups we learned that some really powerful but very simple things. Patients and families don't often know what they can and can't use in the hospital setting. Some folks said we were not sure if we can use the gel dispensers. Are those just for staff? We're not sure if we should use the sink or not. We don't see other patients and families necessarily using these things. We haven't been invited to, we're not sure. Staff were sort of astounded, but also like, well, that is a really simple, not complicated thing to fix. Overarching goals were two. One was, let's promote patient and family engagement at these sites. Let's see what they do. This is a good thing to promote. And let's provide coaching and facilitation around it. But secondly, does this model resonate? Does it still look the same after these additional floors handle it and play with it? Will we see similarities in what they create? And will it start to suggest almost a patient engagement bundle for hand hygiene? Will it start to suggest something we could further explore and help broaden this kind of body of work? So we found that at the various sites that chose to go forward with a hand hygiene huddle, that they had great success with having the conversation, getting product at the bedside in a systematic way for all new admissions, and also putting hand wipes on trays, meal trays. So again, sort of this messaging up front to set the tone, that then could be reinforced in different ways. Reinforced by saying, yes, we want you to participate. Here's a product for you at the bedside. Yes, we want to make this in sort of your line of your daily experience. Here are hand wipes on your tray, a visual reminder. And what we found is that, again, preliminary data, but those patients that remember their nurse or nurse manager engaging them on hand hygiene, they had higher scores on likelihood to provide feedback. That it's not, again, it's not a scientific experiment, but it's an interesting sort of nugget to think about further exploring. You know, is a hand hygiene huddle, or is creating a bundle of patient engagement around hand hygiene, can that help reduce or boost level of confidence, I guess is a better way to say it. Can it help boost level of confidence to provide that feedback to people in positions of power in the hospital?